Welcome to the video about calculating your heart disease risk by the Heart Health Intervention Program. Factors in heart disease include cholesterol, age and gender, BMI or weight, whether you smoke or drink alcohol, your blood pressure, your stress and well-being, your diet, and your physical activity. Cholesterol is what is circulating in your blood. As the amount of cholesterol in your blood increases, so does the risk to your health. High cholesterol is one of the major controllable risk factors for coronary heart disease, heart attack, and stroke. When it comes to cholesterol, this is what you need to remember. Check, change, and control. That is, check your cholesterol levels. It's key to know your numbers. Change your diet and lifestyle to help improve your levels. And then control your cholesterol with the help of your doctor if needed. Cholesterol comes from two sources. Your liver makes all the cholesterol you need. The remainder of the cholesterol in your body comes from foods derived from animals. For example, meat, poultry, and full-fat dairy products all contain cholesterol, called dietary cholesterol. There are two types of cholesterol, LDL, which is bad, and HDL, which is good. LDL stands for low-density lipoprotein, and HDL stands for high-density lipoprotein. Too much of the bad kind, or not enough of the good kind of cholesterol, increases your chance that cholesterol will slowly build up in the inner walls of the arteries that feed the heart and brain. These total cholesterol levels will tell you if you're normal, borderline high, or high. If you're less than 200 milligrams per deciliter, you're normal. Between 200 and 239, borderline high. And greater than or equal to 240, you are high. And you may have high risk for heart disease as a result. High blood pressure is when the force of your blood pushing against the walls of your blood vessels is consistently too high. It is one of the most important screenings because high blood pressure usually has no symptoms and it can't be detected without being measured. The primary way that high blood pressure causes harm is by increasing the workload of the heart and blood vessels, making them work harder and less efficiently. The force and friction of high blood pressure damages the delicate tissues inside the arteries, forcing cholesterol to form plaque along the tiny tears in the walls. This eventually narrows the artery to the point of cardiovascular disease. The chart below shows your category for blood pressure, whether you're normal, elevated, hypertensive stage 1, hypertensive stage 2, or in a hypertensive crisis. Look at these numbers and determine which category you are, for systolic and diastolic. Blood sugar is another important factor in heart disease because about 8 million American adults have type 2 diabetes and many don't know it. Type 1 diabetes often remains undiagnosed until symptoms become so severe that hospitalization is required. 3 types of tests can help healthcare providers make a diagnosis of pre-diabetics and diabetics. These include HbA1c, or glycosylated hemoglobin test. This also includes the fasting plasma glucose test and the oral glucose tolerance test. Fasting plasma glucose can tell you whether you're normal, pre-diabetic, or diabetic. The symptoms for prediabetes, type 1 diabetes, and type 2 diabetes are as follows. If you have prediabetes, you may have no symptoms. But for type 1 diabetes and type 2 diabetes, you'll have increased thirst, increased appetite, increased fatigue, increased urination, weight loss, and blurred vision. For type 1 diabetes, you may have fruity odor or breath, and type 2, you may have sores that do not heal. BMI can be used to determine if you're at a healthy body weight and composition. Being obese puts you at a higher risk for health problems such as heart disease, stroke, atrial fibrillation, congestive heart failure, and more. These BMIs correlate to normal, overweight, or obese. Keeping up with your health screenings. How often should you check your blood pressure? You should check it each regular healthcare visit. or at least once per year if blood pressure is less than 120/80. You should check your cholesterol every 4 to 6 years for normal risk adults, and more often if you have any elevated risk for heart disease and stroke. You should check your weight or BMI during each regular healthcare visit, and you should check your waist circumference as needed only if your BMI is greater than or equal to 25 kilograms per meter squared. You should get your blood glucose test at least every 3 years. And you should discuss any lifestyle habits such as smoking, physical activity, and diet with your doctor each regular healthcare visit.